Hello, I'm Dr. Tara Abu Nasr, Professor of Ophthalmology, Banha University. It's a great pleasure to be here with you in this educational channel. This presentation will deal with the relation between LASIK and glaucoma. In the last years, LASIK gains more popularity and acceptance between our patients. And so there will be an increasing number of glaucoma patients who want to do a LASIK procedure. We all know that myopes are the major category of patients undergoing LASIK procedure. And at the same time, these myopic patients are more or less prone and have a high risk to develop glaucoma. We must educate our patient that LASIK does not cause glaucoma or make patients more susceptible to the disease. I think that these 4 questions can make a frame between LASIK and glaucoma. The first one is it possible to do LASIK in glaucomatous patients? If yes, what's your operation preference? And how can you follow up these patients after LASIK? And finally, how to diagnose glaucoma in post-LASIK patients? The first question, will you operate on glaucoma patients? The answer is yes, but there are absolute contraindications and relative one. The absolute contraindication, like the advanced stage of glaucoma, uncontrolled glaucoma, either surgically or medically, and lastly, surgically controlled glaucoma, especially if it's operated by the filtering surgery. And the relative contraindications are early and moderate glaucoma, and if they are well controlled medically without progression in the field of vision or the optic disc parameters. Why there is a relative contraindication to do a LASIK in a glaucomatous patients? Patients that undergo a transient but significant rise in intraocular pressure during LASIK procedure have risk of significant optic nerve damage. Steroids, which are usually used after LASIK procedure, can increase the intraocular pressure, especially in steroid responders, who unfortunately are more common among glaucoma patients. Lastly, glaucoma drops increase the risk of dry eye, and dry eye is considered one of the more common complications of LASIK procedure. If LASIK become your decision, which type of LASIK procedure do you prefer? Here is the difference between the mechanical microkeratome and the femtosecond LASIK. In the mechanical group, the mean intraocular pressure will rise during suction up to 120 millimeter mercury and reach around 160 millimeter mercury during the creation of the lamellar corneal flap. While in the femtosecond group, the mean intraocular pressure during suction is 90 millimeter mercury and around 120 millimeter mercury during the flap creation. In the photorefractive keratectomy, PRK or LASIK, these 2 procedures, we don't have to make a creation of corneal flap, so we have an advantage to spare the eye totally from this elevation of the intraocular pressure. While In the other two procedures, which we have to do a corneal flap, in the femtosecond group, the intraocular pressure will range between 90 to 120, while in the mechanical microkeratome, the pressure will reach between 120 and 160. Now we will go to the steroid eye drops in the post-LASIK glaucomatous patients. Steroids, especially prednisolone acetate, can induce rise in intraocular pressure after LASIK, which cause transudation of aqueous fluid across the endothelium that collects in the flap interface. The interface fluid leads to inaccurately low central applanation tonometry measurements that obscure the diagnosis of steroid-induced glaucoma, which may result in a serious visual deterioration. Elevated intraocular pressure induces interlamellar stromal keratitis, which is very similar in appearance to the well-known post-LASIK diffuse lamellar keratitis. But the treatment for both is totally opposite. If we use cortisone in the interlamellar stromal keratitis, it becomes worse. On the contrary, it's the first line of treatment for the deep lamellar keratitis. So it's better to use less frequent cortisone drops and the least type of it prone to increase the intraocular pressure, like the fluorometholone. LASIK and narrow angle glaucoma. Acute angle closure glaucoma may take place after LASIK, especially in hyperopic patients. The suction ring and mechanical deformity of the anterior segment structure may play a role for angle closure. Prophylactic laser iridotomy better to be performed before LASIK. Now we go step forwards to follow up of glaucoma patients after LASIK. It's extremely difficult to follow glaucoma patient with measuring intraocular pressure only. Intraocular pressure still plays a major role in management and follow-up of glaucoma patients. Proper and accurate reading of the intraocular pressure after LASIK is crucial. The change in corneal biomechanics after LASIK causes a falsely low intraocular pressure. Refractive corneal surgery changes the cornea's biomechanics in the form of decrease in the central corneal thickness, decrease in the corneal hysteresis, and flattening of the central corneal curvature. Any tonometry that relies on one of these properties will therefore yield different readings before and after surgery. In other words, this reading will be inaccurate. Unfortunately, the existing nomograms that attempt to adjust for corneal thickness and calculate true intraocular pressure are unreliable. And also, there is a controversy in accuracy of the intraocular measurements by applanating the periphery of the cornea. There is other instruments for intraocular pressure measurements that does not depend on central corneal thickness, like Pascal dynamic contour tonometry and ocular response analyzer. Pascal gives the lowest difference between the pre and post-LASIK measurements and had the tightest standard deviation. How can we follow up glaucomatous patients after LASIK? As a rule, we cannot depend only on intraocular pressure. Field of vision, optic disc changes, and nerve fiber layer must be monitored closely. As a baseline, we have to do a new field of vision and a new OCT disc after LASIK as soon as the patient regain a good level of vision. And these tests must be repeated after 4 to 6 months to detect any changes. Very critical point is don't miss glaucoma in post-LASIK patients at high risk of glaucoma. For those patients at high risk of glaucoma, like with a positive family history, it's advisable to measure the intraocular pressure several times before LASIK and again several times in the early postoperative period following discontinuation of steroid. Try to measure the intraocular pressure with one of the newer tonometries, like the Aura, which is available in Egypt. Get a good baseline visual field test and disc image after their vision comes back to a good level, and repeat it after 6 months for any changes. Make sure that patients understand the risks and the need for the yearly follow-up. Take-home messages. It's the LASIK surgeon's responsibility to make clear to those patients that this refractive surgery with perfect vision will not cure glaucoma. Many patients who are happy with the results of the refractive surgery are lost to follow-up. Then it's our responsibility to highlight the importance of routine follow-up to glaucoma patients and those with high risk to develop glaucoma. Take care not to miss glaucoma in post-LASIK patients. Refractive surgery is here to stay. More and more people are going to have LASIK, and it's important to exert more effort and skills to diagnose and follow up glaucoma in these patients. Thank you very much.